Broadcasting from the business capital of the world, this is the Podcast Business News Network.
And welcome back, everyone. It is something that affects women, except it's a big issue in many different regards. It involves the uterus, can deal with, challenges with reproduction and so much more. But as I learn every time we get together with her, that acupuncture can support that and other challenges that women are going through. This is, meiosis. Pronouncing that as close as I can get to it. She is Dr. Kelly. She's located in New York City, and I've learned so much speaking with her in these podcasts, what acupuncture can support and definitely Chinese medicine, even herbals. Great to have you back, Dr. Kelly. How are you doing today?
I'm doing good, Steve. How are you doing?
Doing well, doing well. Now, this challenge affecting women is something that centers on the lining of the uterus. Do I have that right?
Yes. Actually, for this group of people, somehow the lining of the uterus have the overgrow. So there might be some mass. It could be big, it could be small, but somehow it causes the menstrual pain when they have period. So their pain is pretty bad. And also, this also can cause difficulty to keep pregnancy. So for the Western medicine, they have their way to treat it. But it is a very difficult case, I have to say. And but in Chinese medicine, we have our way to treat. We have acupuncture, we have herbal formula, we have moxibustion. So we have different kind of way to help people.
So how does this differ from endometriosis? I've heard that before. I mean, we are talking about the uterus lining and all of that. How does that differ?
So endometriosis, so the uterus tissue can grow in other places. For example, if it is growing in the, for example, ovary or in the ovary tube, or some even like grow in the anus, like it just means it not grow in the correct place. Then people can also have very painful menstrual cycle, and it's very painful, and the pain can be in different places because if the endometriosis, if this group of people have the uterus tissue grow, for example, in the anus, when they go to bathroom, they can have very bad pain. So if it grew in the small intestine or somewhere else, they can also have pain. So that's the difference between the endometriosis and adenomyosis.
So what we're talking about here, adenomyosis is something that affects the normal lining of the uterus and I guess the wall of the uterus. And again, I'm shocked how acupuncture can help with this. Can we break that down? How does that actually work? What are the points for the needles for that? And as I've learned from you many times, the access point for the needles one would not even realize that it's actually taking care of a situation with the uterus.
Yes. So, Chinese medicine, we have different definition about like same disease with Western medicine, right? So in Chinese medicine, we always have a different pattern for even the same term, like same as endometriosis or adenomyosis or dysmenorrhea. So it doesn't matter which term, we have different pattern. For example, one of the pattern can be Qi deficiency, blood stasis. So easy to understand about the blood stasis is, for example, when people have the mass grow in the uterine lining, you kind of like understand the blood kind of like stuck over there, right?
Which I just want to interject here, which I've learned from you is problematic because you everywhere within our body, not just the uterus, but everywhere in our body, we want a constant flow, and that is the chi, as I understand it from you. Loosely put, is that? Would you say that's right?
Yes, yes. So we want the qi and blood, basically. A lot of people translate qi as energy. Um, so basically the energy, the blood, we want everything keep flowing, not stuck, not stagnant. But if somehow, because it could be, for example, people overwork, or could be people, eat something cold. The cold get into the uterus, then cause the stagnate. So the chi stagnant, the blood stays over there. Then the blood just cannot move. They can form a mass over there. This mass can cause the pain and make it difficult to keep a pregnancy. So that is basically one of the pattern for the adenomyosis. But like you said, we want everything flowing. So that's the beauty about Chinese medicine. We can use acupuncture to help the blood keep flowing. We can have herbal formula. We even have moxibustion, which I didn't really mention about it.
Now, you've said many times before when you do acupuncture, there are other organs involved, many times the spleen, the kidney, on and on and on. What other organ might be involved when we're talking about adenomyosis?
Um, could be kidney, could be
Hmm.
spleen. I mention about spleen a lot. Because spleen, the function is transform and transport, right? Transform the nutrients we are taking in to the qi and blood our body can use. They also transport the qi and blood throughout our body. So if people have qi deficiency, could be their spleen is not very strong, so the spleen cannot really kind of like making enough qi for our body to use. Then our qi kind of like deficient. Then the qi is kind of like the command of the blood. So the blood cannot really move. Then people have blood stasis.
What would the treatment look like for adenomyosis? Would it be a number of treatments? What's a reasonable expectation?
So it gonna take a while, I have to say, especially if the mass is kind of like bigger. It gonna take a while. The point is a lot of people they don't know they have it until they trying to have a baby, but they failed again and again. Then, their OB doctor then do some tests and they say, oh, actually you have adenomyosis. Then they come to say, Chinese medicine doctor, but by that time the mass is already kind of like big. So it's gonna take time to move the blood to make the mass breaking down, getting like small enough not affect the pregnancy. So it's gonna take time, but it's gonna help because doesn't matter it's acupuncture or herbal formula or moxibustion, we move the blood. So as long we move the blood, the mass will getting smaller. So the condition will getting better.
If somebody wasn't doing acupuncture for this, what would some of the other treatment routes be?
Well, for the Western medicine, I think they have the hormone treatment.
Okay.
One of the method they give to the patient is kind of put them on a kind of like a menopause stage, kind of
Gotcha.
make the body don't produce hormone or something, so make the mass shrink or something. That's one of the Western medicine way. But in Chinese medicine way, we just move the qi, move the blood, or we tonify you, give you more qi and blood if you're deficient. So it's a different approach. But I think Chinese medicine, we go to the root. right? We make your body getting stronger, make your spleen stronger, make your kidney stronger, make you warmer, make you have more qi and blood, better circulation. In that way, gonna help the mother, also gonna help the baby.
So, not being a trained medical professional or a woman, I look at everything that you're saying here and I would be running to your office because when we're talking about those meds, um, hormone therapies, et cetera, they come with side effects. Now taking the body, putting it in potentially a menopausal state just to relieve this challenge. And now I got to believe now we're going to switch it back to baby mode, if you will, simply put. Uh, so many different variables going on there. Um, right away, acupuncture be my first route. Why wouldn't a woman want to try that? And, be patient because it's going to take a little bit of time, as opposed to putting those chemicals in your body where it's giving you all. I got to imagine if you're, in a menopausal state to relieve this challenge, you're probably going to have those symptoms, maybe hot flashes, all these other things going on. This seems very reasonable. It really does. Um, Everybody's different, but what do you think in terms of regular treatment? How much time do you think it might be before somebody starts seeing relief of these symptoms?
Well, first, it depends on how big the mass is.
Yes.
The bigger, the longer for sure. Okay. And also depends the person. Like if the patient is very deficient, that
Yep.
also may take longer, right? The age also applies and how often the patient can come in, more often, faster to see the results. But in general, I think if the patient can come in regularly, like at least once a week, for maybe like 1 month or 2 months, we could see the result. Actually, I think one my teacher say for any problem related with the infertility, 3 months is the basic. Come in to get treatment for 3 months.
Gotcha. And how many days a week would you say treatment would be, over that period of 3 months? And again, it depends on, the size and everything else going on there. But, just kind of ballparking this. What do you think? Would it be once a week for 3 months?
I think twice a week is better, but if the patient cannot make it, once a week at least, once a week for 3 months, usually patient will see the result for sure. In general, cannot guarantee, but that's in general for any infertility problem.
For sure. And again, there's so many different variables here, but I just wanted to say a little bit of a baseline here. So while we're talking about the uterus, reproduction, all of that, we've mentioned before that acupuncture can support fertility. I want to circle back to that for just a few moments. When you're doing acupuncture for that, again, it's connected to other organs, as I've learned as we've talked. What other organs would be in play here when it comes to somebody, a woman having challenges with fertility?
Very good question. So usually for this group of people, I will have a very special point. It is on the abdomen. It's called uterus point. It's literally the point. It's called uterus point. So basically, when I do either acupuncture or moxibustion, when I put a needle or moxibustion on that point, the energy gonna go to uterus, gonna move the blood in the uterus, gonna give more blood to the uterus. That's one special point. And also, I usually put some points for like kidney, tonify the kidney. Kidney is the root for all the organ. So tonify the kidney, tonify the spleen because spleen in charge of making qi and blood. Better digestion. I also usually calm down the heart. Usually these kind of patients, they kind of like have some anxiety. They're like, I want a baby, I want a baby. So they kind of like heart is on the fire. So I need to clear the heart fire. I also usually put some points like right behind the ear. It's called a peaceful peaceful sleep point to help patient have better sleep. When you have better sleep, everything gonna get better. Your anxiety gonna come down. You have better qi and blood, so your body just feel naturally have more energy.
Um, Scientifically proven what you just said many times over. Would you say, the starting point here for many of the challenges that you treat would be making sure somebody's sleep schedule is good? And would you treat somebody, let's say somebody comes to you, they say, Dr. Kelly, maybe they have endomyosis and not sleeping well either. Would you take care of both of those in each visit?
Actually, yes. Most of my patients they come in. Even sometimes I ask them how they sleep. My sleep is fine. I usually, if they have some anxiety, I will still give them the peaceful sleeping point. So after the treatment, even it's the first time, a lot of patients actually never did acupuncture before they came in. They kind of a little bit anxious. They are like, "Will it gonna hurt?" I said, "Let's try." So I put it in. They're like, "Oh, I didn't really feel it." So after treatment, they had a very good nap. They woke up. They are like, "Oh, I had such a deep sleep." So usually people feel happy after they had a good sleep. So they are happy, they can start their day or go back home, rest. So yeah, sleeping point is usually I use for almost all the patients.
Wow. And it's such a big challenge nowadays. So many people are having sleep issues. Either they can fall asleep and then wake up, or they can't fall asleep. Do you treat multiple things often? Whether it's sleep and something else, or two different health challenges. Is that kind of a regular thing that you do?
Yes, actually, I always treat the whole body. Like, I had a patient came in, I think it's the third week now. So she first came in and said, "Oh, Dr. Kelly, I have the pain, lower back pain. It's very bad. But when I doing the intake, I feel like her leg are really swollen, like very bad edema." So then I said, "I think your kidney is a little deficient." But I said, "Don't worry." In Chinese medicine, kidney can mean kidney channel and kidney organ or. So when I say your kidney is a little bit deficient, doesn't really mean your kidney organ is, in a bad shape or something. But you have edema. So that's definitely a sign of the kidney cannot function very well. So although she come in for the lower back pain, I tonify her kidney. Um, I of course I did the low back pain. She also had numbness. I treated her numbness, and I also figured out that she has like her spleen also deficient. I treated her spleen. She also had neck sweats. I used the hard point, try to clear the neck sweats. Um, so she said her foot, the numbness went away after first treatment,
Wow.
and her low back getting better. So I always treat the whole body, make people's digestion getting better. I actually the young Columbia student, the 23 years old, came back yesterday said, "Hey, Dr. Kelly, I feel like my digestion is getting so much better. I eat something, then I feel hungry. Like, is that because of acupuncture?" I said it could be because acupuncture does like help your digestion getting better, make your metabolism getting better. So he's very happy. So and his tongue changed so much. From his tongue, I can tell the tongue has more qi and blood now, has more color before it is pale. it was kind of like swollen, had teeth mark, now full of qi and blood. It's much more beautiful than before.
So I'm going to be honest with you. The other day, and you mentioned about the tongue all the time. I looked in the mirror, and I remember way back the the edges around the tongue. Mine, I remember a while ago, it had that serrated look. How do you describe that again?
We call it teeth mark.
Teeth mark. Thank you. Um, I don't have it anymore. And I'm just looking for, color and things like that. To me, it looks normal. It's a little white haze to it, which seems normal. But the teeth mark thing, what does that mean actually when you see that around the outside of your tongue?
So usually that is a sign of spleen deficiency because when the spleen is a little bit deficient, so basically the spleen cannot really like transform the fluid we are taking in, so we kind of like have fluid building up. Also in the tongue, when our tongue a little bit kind of like swollen because the dampness, the fluids building up, so the tongue is swollen. When the tongue is swollen, so when you close your mouth, you left the teeth mark on the side. Some people even have the teeth mark even on the tip in the front. So that is even a little bit worse. But usually people have the teeth mark on the sides. So it kind of like the tongue is too kind of like a bit too fat.
But that said, when we talk about a spleen deficiency, doesn't necessarily mean something's wrong with your spleen and, somebody's going to kind of freak out. No, it just means that maybe it's working overtime or it needs some other support. Would you say that's pretty accurate?
Yeah, can be mean like you're overworrying, you are just drinking too much cold drink. You kind of like make your spleen a little bit, not so optimum function very well.
Or working
So,
or working overtime.
yeah, working overtime, you're overworrying, always worry about something, stress about something. Yeah, you can make your spleen not function very well. Yeah.
Amazing. Your website, give it to us, please.
www.kelly121acupuncture.com.
And you're located in New York City. Obviously, for acupuncture, somebody would need to visit you. And people come from the tri-state area to see you because you're fantastic and they get results from you. But certainly on a virtual level, Chinese medicine, herbals, even consultation, that's all available as well when you go to Dr. Kelly's website. Thank you so much for being here today. I learned so much. And I share this information with others. I even spoke to somebody yesterday that just randomly started talking about acupuncture, and I looked like I knew what I was talking about because we get together here. I appreciate it. Thank you so much for spreading the positivity about acupuncture and what you do.
Thank you, Steve.
Thank you. We'll be right back.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.